Welcome.
Merhaba sayın seyirciler, Psikoser'in bu bölümüne hoş geldiniz. Bugün Groningen Üniversitesi'ndeyiz. Yine yanımızda Profesör Arie Dijkstra var. Kendisi sağlık psikolojisi bölümünde profesör. Bugün onunla birlikte sağlık psikolojisi nedir ve sağlık psikoloğu ne yapar gibi güzel konuları konuşacağız. Kendisi bize zamanını ayırdı. O yüzden ona teşekkür ederim. First of all, thanks for accepting us for the interview and sparing your time. We are really honored to be here. And then let me start asking you with, could you introduce yourself a bit to our Turkish audience, maybe in terms of academic background?
Yes, thank you. So my name is Arie Dijkstra. I'm a full professor at the University of Groningen at the Department of Psychology. And I have a chair called Health Psychology or Social Psychology of Health and Illness. Yeah, but it's the better known, this field, as Health Psychology. I started in 1993 as a health scientist, and then I started my PhD, and my PhD was with regard to smoking cessation. And actually it's smoke cessation, but I have regarded this field as the field of behavior change, so health behavior change. And that's also today, I got my PhD in Maastricht University in the Netherlands, then I went to Leiden University, and now I'm working at this university. And what I do actually is about health behavior change. So I look at the field of health psychology and I study how do people change their behaviors and what's the natural process of behavior change. And secondly, how can we influence this natural process by interventions, by information, by changing the environment, and so on. And I do that in very different ways, but it's all about changing behavior.
All right, and then let me ask you maybe a challenging question as an expert in that area for you, because I may ask you to simply define, as parsimonious as possible, what is health psychology?
Health psychology, first of all, is a psychology. So it's not about how many people smoke, how many people are obese, or how bad it is to not have safe sex. So that's not about, it's about psychology of all those behaviors. So in general, health psychology is about all psychological processes that are related to behaving healthy or coping with illness. Yeah, so it's not only about prevention in healthy people, but health psychology is also about, all right, so when you are ill, so how does it feel? What do? How do you cope with the situation? Those are the big target group, healthy people, but also patients. And when it comes to those behaviors, it's not only mapping the psychology of the behaviors, but as I said, in health psychology, we see a problem. There is human suffering, or there is a risk for suffering. So that's also why health psychology tries to change things. And that's why we not only map how the psyche is working, but also how we can change behavior, and how can we influence psychological processes.
All right, so I think it's a wonderful and easy to understand definition. All right, then the next question comes, what does a health psychologist do? Like, in which areas does he or she can work, or what kind of practices should take?
Yeah, well, health psychologists, they can work at very different levels. First of all, they can work at an individual level. So they can help, support, or coach individuals in changing their behavior. Because a health psychologist knows what the psychological processes are and what the suffering is of this person, but also how, for example, people bias their reality, how they bias their risks, so how people try to cope with the risk and their fear. So the health psychology knows this, so he really can coach and help this individual person to change. That's first thing. For example, patients in a hospital, a patient who has been smoking and now has to quit smoking. So the health psychology just can help those people. But also in smaller groups. Health psychologist also knows about social processes and how people are related to each other, how they influence each other. So he or she can also help groups of people, like giving training to people to eat less fatty foods, for example. But also health psychology can design campaigns and information to influence more people. Yeah, for example, a health psychologist might work in a hospital, and he or she, the health psychology, might design information for patients. Yeah, why they should follow certain regulations, what they can expect from a certain test that has to be done, how they might drop their complaints, all things that are related to functioning of large groups of people, like in a hospital. And lastly, health psychologists can also work at a municipal service or a governmental level, in which they help the policymakers to shape certain policies. Like, how could you help to make fewer people smoke? Yeah, you can make a policy from that, from a whole country, for example, or a campus. You can design a policy. And health psychologists, because they know what health behaviors are, how people behave specifically with regard to their health, they can help to design policymakers a good and effective policy. Yeah? So that's in practice. Besides that, there is a need, of course, for scientific health psychologists who study the area, do their PhD, and they gather new knowledge about how we further can understand and change things.
Wonderful. Maybe lastly, we can talk about an example to make these abstract things make a bit concrete about. Could we take an example, any example in your mind about describing the role of health psychologists here, and what is health psychology, to tell this in an example?
Well, as I said, health psychologists sees problems, and so want to change things. Yeah? And one of the things we see now in health psychology, and that's very important, is that we recognize so-called behavioral change strategies. So, and those behavioral change strategies are the things we as psychologists do to help people change. Yeah. So then, and we have now a long list of behavioral change strategies. For example, imagine a person who eats too much pizza. Well, maybe a student who eats 5 days a week a pizza. Well, that's not good. That's not healthy. So how can you help change? Well, and then you see the behavior change strategies are well defined ways to change this, like feedback, like making implementation intentions. Implementation intentions are if-then plans. All right. For example, on Friday evening, when I am hungry, I'm not going to buy pizza, but I'm going to the supermarket to get some healthy foods. Yeah, that is an implementation intention, a plan you make and you put it in your head. It's a behavioral script. Yeah, so you have feedback, implementation intention. You can make social comparisons, compare yourself to others. For example, I look at other students. Well, I see that they don't eat 5 times a week pizza, so it may be a little much. So then you see those behavior change strategies are the effective elements. Yeah, and there are many more, like argumentation, persuasion, framing, positive framing or negative framing, monitoring your own behavior. And those behavior change strategies, there are taxonomies of, for example, 47, but also there's a taxonomy of 139 of those different strategies. And those strategies are the core of the power of what a health psychologist could do. So when you as a health psychologist, you know all those behavior change strategies, well, then you can be effective. Yeah?
And we are talking about the behavioral change strategies like they are scientifically proven, they are
Exactly.
positive evidence that they are working. They are not like friend advice, like they are really good working strategies.
Yes, the strategies indeed are well defined. They are all embedded in the theory, and most of them have empirical evidence.
Yes.
Yeah, and that's so important that you don't just do what you intuitively would feel to do, but as a health psychologist, you learn what is effective, and then you learn to apply this, and you learn this by training. Just doing again and again, shape yourself. Never think, well, I can do it great. No, always be critical at yourself. And then you keep on learning, and then you can become really effective.
All right. Lots of misinformation in the internet about the science, and also, especially in psychology, you know, this sort of science problem and the field. And we are aiming to overcome this problem by providing academic and scientific references in the videos, or doing an interview not like an expert in the quote, or we are doing an interview as an expert, as a scientific scientist as you. So we are aiming to improve the awareness in the Turkish audience by doing interviews. And
I think that's great. Yeah, really. I mean, psychological knowledge can be used anywhere. Well, psychologists, as a health psychologist, I always say, well, everything is psychology. I mean, also politicians, well, they're all deciding people. When you run a company, well, it all depends on what you do, what people do. When you want to change people's behavior, when you make policy, well, it's all behavior. So, and of course there are a lot of things you have to know, but at the end, you want to regulate, you want to change, you want to influence people. And you want to do, and that's one of my points, you want to do that effectively. So it's good also when you have a shop, or when you are a dentist, or when you are a doctor or a nurse, it's good to know how people behave, why they behave, and how you can effectively help them. Yeah, so I think it's especially because scientific knowledge can help to be more effective, more efficient. I think it's important that many people can make use of good knowledge. Yeah, so I think it's great work to diffuse this knowledge as broad as possible. Yes.
Thanks for accepting us and sparing your time for the interview. Any final comments to our Turkish audience?
No, well, you're welcome. I was well. It's great to tell something about health psychology. Well, I hope that you liked it and that you learned something, and that you can use this knowledge also for the good, to help people to lower suffering of older people, of children, to make us more healthy and have better lives.
Thank you. Thank you very much.
You're welcome.
Hoşça kalın.